This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about what the causes of hip pain are. So when you have your hip, you can kind of group them into three different areas. You can have pain in the front of your hip, on the side of your hip, or kind of in the back, kind of buttock area. So we'll kind of go through each area and talk about what could cause it. So if you have pain kind of in the front side, normally that's pain right in your groin. Like if you had to point, you point right to your groin. There's three main culprits that can usually cause that pain. One is hip arthritis. So if you have hip arthritis, normally it hurts right in the groin, not really on the side of the hip. So that's when the cartilage wears away and the bone starts rubbing on the bone, and that can cause pain. That's one thing that can cause pain in the front of the hip. Another thing is something called a labral tear. So your hip is a ball and socket joint, and around the socket there's kind of a rubbery layer called a labrum, which kind of has suction and kind of holds everything in place. And sometimes, usually in younger people, or sometimes people that are involved in car accidents, it can kind of rip that rubbery layer or that labrum, and that'll kind of present with growing pain. Same as hip arthritis, same sort of spot. So that's another reason you can get growing pain. Sometimes people have pain in the front of their hip, and it's not actually coming from inside the hip joint, so it's not coming from arthritis or a labral tear. It's actually coming from a muscle that sits on the top called the psoas muscle. So if you hear your hip kind of click or pop and you got pain right on the front, that can sometimes be from this muscle called the psoas muscle, which helps you lift your leg up. And that can sometimes roll over the hip joint, and you can get some pain and clicking on the front of the joint. Usually just some simple stretching will take care of that. So that takes care of most pains on the front of the hip. Now, on the side of the hip, there's really two things that can cause hip pain. One is on the outside of the hip, there's something called a bursa, which is a fluid-filled sac, and we have them all over our body. They're supposed to reduce friction, but you can kind of get rubbing. Sometimes the IT band will kind of rub on it, especially after long walks or lying on your side. And if you have pain on the outside of your hip, a lot of the time that's from something called greater trochanteric bursitis, or what we call hip bursitis. So that's something that can cause outside hip pain. Rarely you'll see somebody actually tear a muscle, an abductor muscle. Abductors are like gluteus medius and minimus. They let you kind of move your hip out to the side. And sometimes it might not be bursitis, it'll actually be an abductor muscle tear. So that's another reason it can cause pain on the side. As far as the back, most hip-related stuff occurs on the front or the side. If you're getting pain in your buttock region, sometimes you have this big old nerve that runs back there called the sciatic nerve, and there's a muscle that sits right on top of it called the piriformis muscle. So it's not uncommon to kind of get some pain kind of right around there from this piriformis muscle compression, or sometimes if it's a little up higher towards your back, it's the sacroiliac joint. Once you start getting into buttock, lower back pain, it kind of becomes a difficult diagnostic area, with most like hip stuff occurring more on the front and the side of the hip. And then just to complicate everything, sometimes if you have a herniated disc in your back, it can cause referred pain to your hip, meaning that there's nothing wrong with your hip at all, but there's a disc in your back pushing on a nerve and it's causing referred pain to your hip. Probably the most common diagnosis I see is outside of the hip pain, which would be greater trochanteric bursitis, probably followed by hip arthritis. But those are most of the common causes of hip pain. If you have hip pain, I would sort it out first. Is it the front, or is it the side, or the back? Then I would kind of go through there to kind of work out what you may or may not have. Obviously, seeing an orthopedic surgeon will help you do that a lot faster. But that's kind of the general gist of what causes hip pain. So I hope I was able to answer your questions. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But note that I can't comment on what your specific medical condition is or what you should do specifically. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.